Hello, I'm Dr. James Bogash, expert in health and longevity, and today we're going to talk about another one of those highly controversial subjects that came about as a result of the pandemic, and that is masking. And any intervention has a risk-benefit ratio. And sometimes we know the risks, sometimes it takes a long time to determine what the risks are. I would generally say ask any of the 125,000 people who had a heart attack as a result of using Vioxx if they felt that the risk benefit was worth it. You can't ask some 30,000 people because they're dead as a result of taking Vioxx. We didn't know what that risk benefit ratio was. Arguably Merck probably did, but it wasn't until whistleblower got that information out. So it's the case with every intervention, is that there's a risk and there's a benefit. And many times people just blindly look at the benefit and they overestimate the benefit, which is what we've clearly seen with masks. People are like, oh my God, if we just all wear masks for, 48 hours, this would all be over. And we know that that's not the case. Before the pandemic, we knew that it wasn't effective. And since the pandemic, we kind of didn't change very much. You could argue that maybe inside it accounts for a single-digit percentage in change of spread, in which case exercise, sunlight, vitamin D would clearly outweigh that. But what about the risks associated with masking? Well, there aren't any, right? I mean, you just wear a mask, it's not a big deal if you're going to save grandma's life. Well, turns out, I already mentioned that the benefit isn't as strong as most people think, and gosh, wearing a mask just kind of sucks. We had worn it going to Disneyland, and it gets all warm and moist and just disgusting by the time you've worn it for a couple hours. So think about hospitality workers, think about kids in school, think about people on long plane rides. There's just a gross factor with using that. And with that gross factor comes, what about certain bacteria? What about, are we actually harboring a growth of different types of microorganisms? And the easy answer is yes, but we really haven't seen any studies on that until now. So this was a particular study taken out of Japan, looked at 109 people, and they looked at different types of masks, so the woven, non-woven, so you think like your disposable type masks, like your surgical mask, versus your washable, reusable type masks that are woven. And most of the masks used were the non-woven type, so think of the disposable surgical masks. Not even going to talk about the environmental impact of those polyurethane type. It's just stunning that we were worried about the environment, and all of a sudden we're like, hey, just mask it, we'll worry about the dolphins later. And so what did they find? Now, most people used them for just one day, 68%, and then 2 and 3 days was a little bit longer. Granted, there's the disposable type, and then the woven, the wash reusable type. So researchers looked at the cultures on the face side and on the outside of the mask, and they found that 99% of them had bacteria on the inside. That it was 13 times higher on the inside than on the outside. That has everything to do with the moisture from breathing, and it collects in there and it becomes a great place for bacteria to grow. A couple things that didn't make a difference was gargling. So stopping the thinking you're destroying bacteria in your mouth, which has a side effect of potentially raising blood pressure. But gargling didn't make a difference. Washing didn't make a difference on bacteria count. So it's not a matter of just keeping your mask clean. Mode of transportation didn't make much of a difference. So if people were potentially exposed to more bacteria from outside on public transportation versus walking versus driving your own car, riding a bike, there was really no difference in that. On the other thing they found were fungal colonies. And 79% of the masks had fungal colonies on the inside. Now, the counts were higher on the outside, but so clearly these things do become a breeding ground for bacteria and fungi. Some of these are potentially pathogenic, especially from the fungus that was found on the outside. Enough so that the author suggested that maybe immunocompromised people should not be wearing masks for long periods of time. Which is exactly the opposite of what people suggest, that we should be wearing masks because there are immunocompromised people out there. Ironic, but this just boils down to the fact that there's so many people that have sided with the use of an intervention without balancing that out of risks. And they have overestimated the benefit and completely ignored any potential risk. And so that's a problem. And as time goes on, we're starting to see, we've never before done this. You could say, oh, well, surgeons wear masks, but that's so they don't get spittle on their open heart patient and lands on the left ventricle and creates a problem. Never have we had an entire culture, society wearing masks for long periods of time. And so we're starting to see some of the potential downsides with that. As always, I'll post a link to this particular study in the description. Make sure you like this video and share it with somebody who you think needs the information.